samples from bodies, from autopsies, of about 23, 25 patients. You've looked at 3 so far.
And there's spike protein present. There's spike protein in heart, there's spike protein in brain, there's spike protein in liver, but there's no nucleocapsid. And these were deaths proximate to, in most of these patients, their second shot.
And so, how proximate to the second shot are these?
The one was 5 days out, another was a couple weeks out, and another was a couple weeks out. Some of the others I have, most of them are within a couple of days to about 2 months. The other ones I haven't looked at yet, but the ones I've looked at, it's proximate to the shot, the second shot.
So a lot of people don't know that the actual peak of the death is like 5 months out.
Correct.
Do you want to comment on that, because you saw the?
Yeah, it's an aggregate of multiple mechanisms: activation of other viruses, spike causing clotting, mitochondrial fatigue, and I would suppose in all of these, those mechanisms, there's multiple more. You saw my talk this weekend. It's about anywhere from 12 to 20 mechanisms, but the compounding of those mechanisms over time are obviously causing chronic disease. A great example of this is Dr. Malhotra in the United Kingdom, a cardiologist, prominent cardiologist. His dad was healthy, well, had a good cardiac exam. After his second shot, about 6 months later, his dad passed away. He had
severe coronary disease.
Severe coronary disease. So all these little mechanisms, the spike causes inflammation in the vessels. That's the primary route. Every organ in your body has vessels in it. So if you're causing chronic inflammation in the vessels, you're causing a chronic disease that eventually can lead to failure. In his case, severe atherosclerosis that he didn't have prior. So that's the question, is all these mechanisms, instead of like a wildfire where we see people pass away quickly from probably anaphylaxis from polyethylene glycol, in these patients we're seeing more of a smoldering wildfire until the burden of disease and the burden of inflammation finally adds up to incompatibility with life.
So you could easily be killed by the vaccine a year out, 6 months out, 3 months?
Based on your data sets, that we've looked at from around the world, it's, 5 to 6 months seems to be the peak, but there's no reason, again, based on the lack of studies, that it could